Hello, everyone. I hope you're having a great day wherever you are. Welcome and thank you for joining us for the virtual Canada Health Infoway Partnership Series. I'm Suhanna Marchand. We do have attendees participating from across Canada and around the globe. Let me take these opening moments together to acknowledge that the lands on which we are hosting this event include the traditional territories of many nations. Canada Health Infoway recognizes that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and their well-being. Canada Health Infoway respects that Indigenous peoples have rich cultural and traditional practices that have been known to improve health outcomes. So I invite all attendees just to take a moment to reflect on the territories you are calling in from as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and of course, contributing to reconciliation. As for me, I am thoroughly excited to be back here as your MC for this session number 3. As a journalist, covering this pandemic, as you can imagine, has been a top story. I hope you've been watching. Our health is a priority, of course, for all of us. And I think we've learned new ways to access health care. We've adapted during this very challenging pandemic. And as we hopefully, I'm crossing my fingers here, as we hopefully reach the tail end of it, we're going to continue moving forward with all of the lessons learned, and there are many. And I suppose the best thing is we'll be moving forward together as partners. And speaking of partners, the virtual Infoway Partnership Series is proud to be patients included. Infoway will continue to convene events which adhere to the accreditation. In collaboration with its patient partners, Infoway has developed the Patient Family Caregiver Recognition and Inclusion Statement. And this statement really acknowledges the critical role of patients, of families, and caregivers, and it underscores the commitment to collaborate with them in working towards improving the health system. So let me just take a moment and read that statement for you. This is from Canada Health Infoway. We recognize the unwavering commitment and essential impact patients, families, and caregivers have and will always have on the Canadian healthcare system. Canada Health Infoway pledges to continuously listen to the perspectives and learn from the lived experience of patients, families, and caregivers to ensure respectful collaboration in the work we do and influence. We look forward to building true partnerships and acknowledging shared successes. The patient advisor for this July 20th partnership series is Christine McKinnon. So welcome to you, Christine. Christine has been an advisor for the overall program development. So a very big thank you, Christine, from the team at Canada Health Infoway for your support. As I say, great to have you with us. Before I move on to the first session in the agenda, I just have a couple of quick notes to cover. We do have simultaneous interpretation available for all Infoway Partnership Series sessions. So to listen to the session in French, just follow the instructions on the screen. Here's another thing. We also have closed captioning services available. So to enable English closed captioning, simply select that CC button that you see right there. It's on the bottom right of your video player. And check out the polls. Share your experiences. You can find live polls on the right-hand side of the main stage video stream. So I'll urge you to go over there and check those throughout the session. Now, we have planned to allow for questions at the conclusion of all presentations, should time permit. So please submit questions throughout the program via that little Q&A box. It, again, is under the main stage video stream because we'd love to have your participation in this session. Get your questions answered by the fantastic speakers that we do have planned. And at the conclusion of today's broadcast, Share your event feedback. You know how important that is to get your thoughts to make further future sessions better, to make them, more, I suppose, streamed towards the things that you want to talk about and learn about. And you can find the survey at the right side of the screen. We also welcome you to engage with your fellow event attendees in the platform chat. And you can find that chat very easily by clicking on that blue talk bubble icon. It's at the bottom right-hand corner of the screen. And the chat can be used in two ways. You can share your comments with all attendees so everybody can see that, or you can message specific attendees directly and have that conversation should you wish. So all of that housekeeping out of the way, on to the program. It is my pleasure to introduce Vicki Kendall, patient partner and co-lead for the Citizen Support Desk, along with Emily Hamilton, Dominic Stoll, and Jesse Yang. They're all on your screen. They are from the Provincial Health Services Authority. So welcome to you all, and I leave it to you.
Thank you very much, Suhana, for the kind introduction. And thank you, Health Canada Health Infoway, for giving us the opportunity to present our work in the context of partnering for success. I'm just waiting for our slides. Here they come. We indeed strongly believe that there is no success without partnering. As a matter of fact, one of our guiding principles is, if you want to go fast, go alone. If you want to go far, go together. Emily, Vicki, Jesse, and myself have partnered up today and are honored to co-present the outcomes from a truly pan-provincial collaborative team effort on the rapid implementation of virtual health visit tools and a citizen support desk for virtual health visits during the pandemic. We acknowledge that we are joining today's virtual event from Vancouver and Coquitlam, British Columbia, which is one of the traditional homelands of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam people. We acknowledge these homelands and recognize and respect the Indigenous people's presence. This reminds us of the importance of establishing healthy and reciprocal relationships that are key to reconciliation. Over to you, Emily.
Of many different organizations. It's quite a complex system. We have a Ministry of Health. We have 4 regional health authorities, 1 First Nations health authority, and multiple organizations that focus on primary care. And then we have a provincial health authority, which is where Dominic, Jesse, and I work. The Provincial Health Authority focuses on providing specialized services across the province, as well as provincial coordination. And the Office of Virtual Health, which is our team, is part of this health authority. In March 2020, shortly after the global pandemic was confirmed, BC declared that we were in a public health emergency. So as a health system, we needed to work together to figure out how to maintain continuity of care for our patients while ensuring they could remain safe and healthy in their homes. This was a challenge given that before the pandemic, most care was provided in person. So BC's Ministry of Health, the health authorities and health organizations that I mentioned came together to coordinate how we could rapidly implement virtual health solutions across the system. Working together, we removed barriers and implemented virtual visit solutions and remote monitoring solutions. So work that previously would have probably taken years was achieved in a matter of weeks because we were all working together towards one goal. I'll now hand things back to Dominic.
As Emily has mentioned, the virtual health teams across the province partnered up and coordinated an effective response to the COVID-19 pandemic. One of the first order of business was the rapid implementation and scale-up of a virtual health visit tool to meet the requirement for physical distancing. Based on previously gathered information and lessons learned during the pre-COVID demonstration phase, we knew that the ideal virtual health visit tool should be easy to use. Ideally, patients and providers are already somewhat familiar with the technology, and the tool should be readily available and scalable. Zoom was already a fairly popular video conferencing platform in 2019, but at the onset of the pandemic, the number of global meeting participants jumped from 10 million participants per day to over 300 million participants per day. British Columbians were also amongst those 300 million people who flocked to this easy-to-use platform to connect with family and friends near and far. The healthcare version of Zoom, which is a platform with enhanced privacy and security configuration, met all the criteria outlined above. The technology was readily scalable, and thanks to the partnership with the California-based company Zoom Video Conferencing Inc., we could also make the platform readily available to all healthcare providers and patients across the province of British Columbia. The speed of the rollout was of essence. While we still worked out a contractual framework between Zoom and the health organizations in BC, the company supported us with the implementation and the scale-up of Zoom as a virtual health visit tool across BC. Within only a few weeks from the start of the pandemic, we added this virtual health visit platform to the tool belt of over 20,000 clinicians across the province. The virtual health teams worked around the clock to develop and share any educational materials to help train the clinicians and patients on how to have appointments virtually using this technology platform. Work that was enabled with the partnership and funding from Canada Health's Infoway. As clinicians became more comfortable with virtual health visits, the number of virtual health encounters steadily increased over the last 16 months to 1 million virtual health visits using Zoom for healthcare. After 16 months of nonstop work, this was time to take a breather and celebrate our successes. The 1 million virtual health visit milestone was announced and celebrated on social media, TV, and radio stations across BC. Thanks to the tremendous effort from all the IT departments, health authority clinicians could continue to rely on the service desk for technical support, including support for virtual health tools, despite the onset of the pandemic and the concomitant shift to virtual care delivery. In addition to the availability of the technical support desks, virtual health teams also established onboarding support to make the transition to virtual health visits with Zoom for healthcare for clinicians easier and faster. An infrastructure to offer technical support to patients, however, was not in place. This was recognized early on in the pandemic as a major gap. To identify how big the need for a citizen support desk was and how technical troubleshooting impacted the virtual health visits, a survey across BC's health organizations was conducted. Over 300 clinicians took the time out of their hectic schedule back in summer of 2020 to complete a survey. 50% of the surveyed clinicians responded that they had to offer onboarding support to patients before they could use the virtual health visit tool. And over 60% of these surveyed clinicians indicated that they had to provide technical support during virtual health visits. Furthermore, 80% of the clinicians reported that their virtual health visits were delayed because they had to provide technical support. So based on these results, it was evident that the lack of a technical support desk for patients had very significant negative impacts on the care delivery. The survey respondents estimated that 3 out of 10 patients would actually need technical support. As a matter of fact, based on these survey results and a forecast of 1 million virtual health visits, it was predicted that clinicians would spend a cumulative up to 1.5 million minutes to resolve technical issues instead of addressing the patient's health. This is equivalent to 3,333 days of clinician time not spent addressing the patient's health. Although these were highly inaccurate projections, they clearly provided enough evidence that the need for offering technical support to patients was urgent and the potential benefits to both patients and providers significant. The search for sustainable commercial vendor for the Citizen Support Desk service was slow. Therefore, we felt compelled to act fast and establish a temporary solution. Building on a strong pre-existing partnership with the PHSA Office of Virtual Health and the PHSA IMED's video conferencing service team, we moved from project approval, hiring 2 staff, to the launch of the Canada Health's Infoway-funded Temporary Support Desk in less than 5 weeks, with a soft launch on September 1st, 2020. The initial scope of the support desk, which is offered over the phone, included support of technical issues for virtual health visits with Zoom for Healthcare. The service is available from Monday to Friday from 7 a.m. to 5 p.m. As more health organizations joined the support desk, the service was iteratively improved and the support scope was broadened to also include technical support for patients participating in virtual health visits using Teledoc. It's a solution which in BC is also known as BC Virtual Visit. The Provincial Citizen Support Desk Working Group was formalized to plan the transition from a temporary to a more longer-term solution and to develop requirements that meet the needs of all virtual health patients across BC. In June 2021, the decision was made to convert the current temporary support desk operated by PHSA's video conferencing services team into the longer-term support desk. So how successful was this temporary citizen support desk? In a 5-month time period from January 2021 to May 2021, the temporary support desk was contacted over 2,300 times. In the context of Zoom, this means that 1 out of 200 virtual health visits, or 0.5%, resulted in a patient call of the Citizen Support Desk. Peak calling times are generally between 10 and 11 a.m. and between 1 and 2 p.m., with more calls midweek. With an average handling time of approximately 7 minutes, this equates to about 266 hours over a 5-month period. This is time freed up for patients to discuss health-related topics with clinicians and not spent trying to troubleshoot technical problems. How are we incorporating the patient voices into our work? The Office of Virtual Health's ambition is to improve the patient experience and outcomes. We strongly believe that this can only be achieved by partnering with patients. Our roadmap for patient-centered partnership includes identifying the patient needs, co-designing with patients, and evaluating with patient input. We have heard about the patient needs from the clinicians before establishing a temporary citizen support desk, but we wanted to ensure that we directly include the patient voices in our project. In partnership with the Patient Voices Network, we recruited the help from our patient partner and project co-lead Vicky Kendall to help us convert the temporary citizen support desk into a patient-centered service that meets the patient's needs. The province of BC is very fortunate to have you, Vicky, as the patient voice and as the project co-lead for the Citizen Support Desk. So big thank you to you, Vicky. I will now turn it over to Vicky to share her experience.
Patient Voices Network is a community of patients, families, and caregivers working with healthcare partners to improve our healthcare system. It was started by the Ministry of Health in 2009. Today, whether it is a ministry, health authority, hospital, community care, pharmacy, or doctor's committee, you will usually see at least one, if not more, patients at the table. I have volunteered with PVN for about 8 years now. My longest ongoing commitment has been with the Provincial Surgical Executive Committee. Others have been shorter, like the Surgical Pre-Optimization Collaboration with the Doctors of BC that is just winding up after 2 years, or the Tri-Cities Community Forum on Narcotics, which was just one evening. We can apply for as many or as few of the postings as we wish. This is the first time I've been asked to co-lead a project, and it has been exciting. All people in BC are potentially the clients for the Citizen Support Desk. There is a wide range of ages using the support desk, but here's some feedback that was captured from a survey in November. The overall rating of the virtual health visit and satisfaction with Zoom were rated at 95 out of 100. Cultural safety and respect was rated at 94 out of 100. Benefits of virtual health visits showed a high of 97% for saving the patient travel time. But not all respondents were satisfied with the instructions and technical support they have received. As the working group was coming close to finalizing the specifications for the longer-term support desk, we gathered a focus group of patients to ensure that we were going in the right direction. They confirmed many of our decisions, and where we were undecided helped us determine the recommended course. Patients were enthusiastic about the ability to have test calls prior to the actual video health visit to ensure that their equipment was working and they were comfortable with the screens. Many of their comments were about the invitation template. We forwarded these suggestions to the proper group, and changes were made to add the name of the person the appointment was for, the time and date of the appointment, indicate the clinic contact information, and make the support information more visible. There were several other changes made, all in order to help the patient know that they had all the information they needed to have a successful health video chat. Operating hours were discussed, and the focus group was happy with our base hours, but wanted to see them expanded to include weekends and stat holidays. I knew right from the beginning that this desk needed to serve everyone in BC, so ensuring that we have spoken and sign language interpretation was critical. This was also of importance to our focus group. As well, we needed to address the needs of our Indigenous patients in the focus group who were concerned about cultural safety and the lack of Indigenous languages. While one health authority was helping patients reschedule appointments, this was a time-consuming and often unsuccessful effort. The focus group was unanimous in stating that this should not be in scope for the support desk. I will now turn you over to Jessie.
As a provincial working group, we partnered with health authorities in BC to validate current support scope and evaluate additional requirements, such as the ones our patient partners have identified through the focus group discussions. And here's an overview of the new requirements that we're implementing. We listened to the focus group feedback and are expanding operating hours on weekdays and adding weekend support. Our provincial partners have emphasized the importance of having the patient testing the connection before the actual visit. So we'll be promoting the concept of test calls to our patients and providers, where the support desk will support the patients through this process. Additionally, as a provincial working group, we have clarified what type of virtual visits we should support. In addition to the obvious patient-provider virtual visits, we have also identified the importance of well-being visits. Oftentimes, this is part of a care plan where patients are encouraged to connect with friends and families virtually. To continuously improve the support desk service, we'll be offering each caller an opportunity to complete a quick satisfaction survey at the end of their call. And to ensure service level, we're evaluating a new call center solution to be able to track data such as call wait time. And our goal is to ensure 80% of the calls are answered within 60 seconds or less. And through the provincial working group and patient focus group discussions, it became clear that health equity was an important issue to address. So in addition to the spoken language interpretation service, we are also partnering with BC's Provincial Language Services team to offer American Sign Language support, as well as Indigenous languages interpretation service. In an effort to ensure cultural safety, all support analysts for the support desk have and will be taking the Senya's Indigenous Cultural Safety Training offered by PHSA. And to continuously improve the service, our evaluation framework will assess the following: accessibility, to ensure calls are answered within the service level and ensure patients and providers are aware of the service. By offering the satisfaction survey to all callers, we'll be able to assess the appropriateness, effectiveness, and cultural safety of the service. We'll continue to work with our partners to ensure equity and leverage data to be collected by the new call center solution to measure efficiency of the support desk. To continue collaborating with patient partners after the pandemic, we'll evaluate input from the satisfaction surveys, and Vicky will continue to co-lead this initiative. And as the internal funding continues until March 2023, we'll evaluate our options with our provincial partners, including the Ministry of Health, to continue the service. And I will now turn this over to Emily.
From our presentation that the work that we've shared could not have been completed without strong partnerships with our patients, their families, clinicians, clerical staff, and administrative staff across the health system. And as a system as a whole, we've experienced the power of collaboration through this work and through these meaningful accomplishments. So thank you very much for your time today. We can now go into some questions.
And that leads you back to me. I want to thank you all for those presentations, great information. And, obviously some challenges still ahead. Vicky, let me ask you what the benchmark of success will be as you continue your work in co-leading this. Where do you hope to be in 6 months? Because you've come a long way in the past 6 months.
I think the measure of success will be that we are able to answer every call that comes through and be able to successfully handle the cultural safety that's expected from the Indigenous groups that we hope to be able to bring online to the service.
And, one of the things you haven't mentioned, or at least I didn't catch it, was the security of information. Whenever we hear about Zoom calls with names of patients, times of patients, and information being shared, have you, in fact, and let me pose this to you, Dominic, had any hesitancy because of the security concerns over virtual health care?
Yeah, good question, Joanna. At the beginning of the pandemic, there was, Zoom was in the news all the time, and it wasn't just good news. It was all about Zoom bombing and other security breaches. And so we took this very seriously. And first of all, we used a version of Zoom, which is called the Zoom for Healthcare, which has additional security and privacy configurations to make it a secure, better and more secure platform. What we also did is we communicated very often, so worked very closely with our communications team within OVH and within PHSA and our partners to really reassure people that some of these news items and breaches that did occur can not occur on our platform. And of course, we also established best practices to ensure that providers and patients really knew how to securely use the platform. So it was very satisfactory to see that in the survey, neither providers nor patients raised any concerns in regards to security or privacy with using Zoom for healthcare.
I want to thank you all for your insight, for the stories that you've shared, the graphs you've given us, and I know attendees will take that information away and be able to use it in their own provinces as these initiatives that Jesse mentioned continue. But thank you for your time. That is Vicki Kendall and Emily Hamilton, Dominic Stoll, and Jesse Yang. You guys be well, okay?
Thank you very much.
Thank you.
Thank you.
Thank you.
And before I turn it over to Infoway's Barry Burke, allow me just to take a moment to share a short video with a few jurisdictional partners around that theme of today's series, which is the value of partnership.
Partnership for us in Newfoundland and Labrador has been crucial, and we've accented really community groups. We have under our mental health renewal policy towards recovery, created a recovery council. This is a group of people with lived experience who advise me, the minister, directly on what they feel mental health and addiction services should look like across the province. It's kind of like a customer feedback system, and it has been invaluable in tuning and directing what is a major refresh of our mental health and addiction services. Another form of partnership has been a little bit more tangible in terms of finance. We have a group called Channel. These are people, again, with lived experience, and we have supported them to provide online peer support one-on-one for around 12 to 18 hours a day for people who are upset, who need support, and are not really in crisis where they would reach out through emergency services. This has diverted people away from emergency rooms. It has directed people to resources within mental health and addiction services more broadly. But that connection with people with lived experience has proved invaluable. And these partnerships have enabled us to turn what was very much an institutionalized system into one that is much more patient-centered, family-centered, and focused around the needs of the individual who calls us. Without these partnerships, we would not have benefited. The people of this province would not have benefited, and it makes good sense.
Hi, I'm Michelle Harriott, Chief Information Officer with the Department of Health and Social Services, Government of the Northwest Territories. For a small jurisdiction, resources and capacity, not just funding, but people capacity, are extremely constrained, especially with the constant increase in pressure for digital solutions to enable improved service delivery and outcomes for our clients. Yet to implement and support key technology for a small organization still requires some of the same level of rigor and expertise as any large organization. So partnerships have been a key to success for the NWT. And from a technology perspective, we have partnerships with 2 jurisdictions, and we have partnerships from a client service delivery perspective as well. I can speak firsthand of the information and technology partnerships and say without a doubt, partnership has been extremely beneficial and an incredibly positive experience. We would not be where we are today without our partners, and certainly would not have been able to achieve the implementation timelines and success with the solutions we've been able to put in place. And our jurisdictional partners are genuinely interested in partnering for success. It isn't just about sharing documents and lessons learned, but it's about directly bringing their experience to the table and applying it with us along the way. An important aspect is they also have established relationships with vendors, and we share common goals of improved outcomes for clients and using taxpayer dollars wisely in the process. Partnering and reusing solutions has enabled us to reuse years of energy and investment, an investment that's already been proven, put into practice, and works. And the support we experience is second to none. And this last piece is unsolicited, but I also want to mention that when we think of partnerships, Canada Health Infoway is also top of mind as a true partner for us. It isn't just about strategic funding and services, but they are a group that we can call on for support, expertise, and we know they're vendor neutral and have a genuine interest in helping us achieve results. Infoway has provided a forum to bring pan-Canadian health leadership together to share experiences, and often has the pulse of what other jurisdictions are doing when we are looking to connect on a particular item. So when we consider investments in the NWT, partnerships has provided a strategic advantage, and we wouldn't hesitate to explore more in the future.
And it's great to get those perspectives from the East Coast, arguably the friendliest province in the country, and also from the Northwest Territories. You can see I'm sharing the screen. But let me just thank the Honorable Dr. John Haggie and Michelle Harriott for addressing, by the way, the multitude of aspects of partnership. So you can see I'm sharing the screen now with our next speaker, who I'd like to welcome to the virtual stage. Barry Burke is Executive Vice President, Virtual Care Programs, Canada Health Infoway. Hello to you, Barry. Barry, I think you might be on mute.
So I am.
There you are. There's those dulcet tones.
Yeah, dull tones or dulcet. I'm not sure which. And
No,
by the way,
I didn't say dull.
even though you couldn't hear me before, believe me, we're friendly here in Alberta as well. So I just wanted to give a shout out to my Alberta friends. Thank you, Suhana, and thanks to everyone for joining us here today. I want to thank our earlier panelists for a very informative session. I like Dominic's opening remark about there is no success without partnering, and that's really the theme of the entire conference today. They gave us an amazing example of partnership delivering real value to Canadians, to citizens, to the people of BC. So that was I thought, a tremendous kickoff. I particularly enjoyed the focus on, or took note of the focus on, health equity and cultural safety as well. Thanks to Mr. Haggie and to Michelle for talking about the value of partnerships and some of the very creative approaches that they're pursuing. And Michelle, thank you very much for the Infoway shout out. As Suhana said, I'm Barry Burke, Executive Vice President of Virtual Care Programs at Infoway. And I'm going to give you my perspective on virtual care, but I'm going to kind of put it in a few different buckets. I'm going to look at what happened last year, where we are now, and what I think the future holds. You'll see that I include a number of facts and figures and numbers and survey results. If you want more insight into those numbers, I'd invite you to please visit our website, where we've got all of the detail and all of the methodology that by which we arrived at those numbers. So if we look at what happened last year, the onset of the pandemic clearly led to a sudden, almost immediate transition from in-care delivery to virtual care. And again, one of the panelists this morning talked about that. It required an unprecedented level of cooperation, collaboration, and partnership amongst a large group of stakeholders. And again, the panelists this morning talked about that. People who maybe hadn't worked together traditionally had to come together because of the urgency. The great news from our perspective is we were able to build on a legacy of investment and a foundation that we had built over the last 20 years. I think this foundation really allowed us in Canada to make a quick shift to virtual care. I would also point out that the shift was not just about technology, and the sense of urgency didn't just result in technology and innovation, but also innovation in policy. Some things that had been barriers to virtual care and to moving forward on some of these agendas were obstacles were overcome in a matter of days and sometimes in a matter of hours to allow virtual care to really flourish. The results were tremendous and show great promise for the future. The pandemic has demonstrated that Canadians want to move towards a health model that at least includes virtual care. And when we did some surveys out of the pandemic last year, and you can see them on the slide here, 91% were satisfied with their virtual care experience. 86% agreed that virtual care should be an alternative going forward. And over 3/4 want to use virtual care even after the pandemic. So that was what was happening last year. The other thing that happened was really the federal government stepped in and, as made a necessary investment in virtual care and provided new funding based on a set of agreed to priorities. And we at Canada Health Infoway continue to work with our federal partners, the provinces and territories, and the private sector to improve virtual care delivery. This includes not only a focus on standards and technology. Suhana asked the question of the panelists about privacy and security, which is obviously critical. But as the panelists talked about, it's the human aspect also. It's not just about technology and widgets. It sometimes is about things like change management and training for clinicians. They were thrust into a position where they were using perhaps tools and technologies that they hadn't used before. And as the panel talked about, this whole issue of improving digital health literacy for all Canadians, this is critical. The panel on the Citizen Support Desk shows what could be done in a very short period of time, how they stepped up and filled a gap that was there. I think one of the programs that we're working on is trying to look at a very systematic view to increasing the digital health literacy for Canadians. If we're going to start to rely on digital tools and technology, we need to have the appropriate level of comfort with those same tools and technologies. And of course, everything we do at Infoway has a rigorous approach to benefits evaluation and measurement. We want to make sure that we know not only what we're doing, but the value that it's driving. So if I look again where we are now, Canadians embrace virtual interactions in most areas of their lives: banking, retail, food delivery, particularly through the pandemic, online travel. Again, maybe not so much in the pandemic, but hopefully, as Suhana said, many fingers and body parts crossed, we'll be doing some travel in the future. And they've really come to rely on virtual interactions to make their lives convenient. And they certainly have a strong appetite for the healthcare sector to catch up to these other industries. Our surveys also tell us that Canadians want us to keep pace with what's going on in other countries. They do look at the internet, they do get news from other countries, and they want to know that we're keeping up with some of those advances. Our surveys have told us that Canadians prioritize what we call here first order challenges. And really what we're talking about here is things like reducing wait times, improving access to providers, and alleviating inequities in the system. And again, we talked about that a little bit in the panel. So if you look at where we are now, we recognize that Canadians recognize that technology can empower them and really can help them manage their own health, can help them make more informed decisions, contribute to better health outcomes for themselves, for their family, for their loved ones, and also contribute in a small way to making our system more sustainable. They recognize that technology can improve the continuity of care and information sharing between them and their providers, and between them, their providers, and other family members that are authorized through privacy and security mechanisms to have access to their information. Although there's lots of promise, there also, we need to, and again, the panelists talked about culturally safe and ensuring equitable access and health equity. We recognize that a digital divide does exist for some Canadians, and we're working to ensure that equitable access to digital tools is there for everyone, including remote and Indigenous communities. So where we are now, and again, this is also a little bit of a look back, this snake chart as I call it, is a little look back to 2020. I talked about our rigorous approach to measurement, and we wanted to make sure that virtual care is really adding value to Canadians, for Canadians, to the health system, and to the environment. And we've done some significant research in the area of value of virtual care. Some of the benefits are very obvious. Others are less so. For example, the estimated reduction in the carbon footprint resulting from the use of virtual care in 2020 is the equivalent, as it says on the slide here, to powering 50,000 homes for a year, or the equivalent to taking 60,000 passenger vehicles off the road for a year. So really a substantial impact to the environment. One of the folks from the NHS has told us in the past that the healthcare accounts for 20% of the carbon footprint in downtown London, England, for example. We've seen it, that is obviously a tremendous impact on the environment and can create a better world for all of us. Our analysis has showed us that Canadians saved roughly 90 million hours in patient time by not having to arrange for care for dependents, not having to take time off work, and not having to travel to attend in-person appointments as a result of the use of virtual care. When we add that all up, we come up with a figure that says that the savings for Canadians resulting out of virtual care in 2020 was about a little bit over $6 billion. So again, significant, and we have a ton of information, a ton of research backing the numbers that you see here. So I'd again encourage you to look at our website if you're interested in more. In terms of where we're going, I'll talk a little bit about where we are going from an Infoway perspective. And first of all, we're building on the success of our current programs. We believe that we have had some significant success in 2020, and we're going to build on that in 2021 and beyond. We look for our partners, back to the theme of partnership, to work with us and Canadians to ensure they have a much more connected healthcare experience. We're working to implement virtual care initiatives and making quality care more accessible. One of the major things is to improve Canadians' access to health information and digital tools and things like e-prescribing. One of the challenges is just making sure that people are aware of what's out there. There's the usability and the digital health literacy, but just even knowing where to go. And I know, again, some provinces are starting to promote some of the tools that they've got available to help Canadians as they make this transition. We also want to improve the communication between patients and their providers, and quite frankly, between providers themselves when you talk about things like e-referral and connection to specialists. As we say on the slide, one of the major focuses for us is interoperability. That's a big word that has a simple meaning, which is we want the systems to talk to each other better so that information can flow and follow the patient and is more accessible and usable. With the appropriate consideration, as we've talked about, to privacy and security. To do that, we're looking at both national and global best practices and standards for interoperability. We're also going to leverage the experience and expertise that we've gained, and Michelle mentioned that in her video. We've gained over the last 20 years. We provide strategic investments, facilitate stakeholder partnerships, and one of the things we've been doing a lot of in the last few months is enabling multi-jurisdictional procurements to help provinces and territories have solutions that meet the needs of Canadians. As I said, we'll continue to evaluate the impact, look at solutions maybe that we can scale in certain provinces or jurisdictions, and perhaps ones that we can spread from one province to another, from one region to another, trying to set a common national direction that will benefit all Canadians. Through all of this, and if the last year has told us anything, it's that you can't lock a plan and a strategy in the ground, or you can't carve it in stone, because you have to be nimble and responsive to the changing needs of the jurisdictions and the citizens that they serve. So last comments on where we're going. The theme today is on partnership, and so we will continue to work in partnership with our key stakeholders and focus on the areas that are really most critical to success, the continued success of virtual care. And again, I wanted to say that we really did have tremendous success last year in spite of all of the challenges, but we've now got an opportunity to make it even better as we go forward. During our 20-year history, we've connected with our partners in the public and private sector to help to really establish the foundational systems that we're able to do virtual care in 2020, and that will give us the foundation going forward. One of the things that we do at Infoway is we are connected to our global partners. So there's global leaders in virtual care. We will learn from them and try to make sure that we learn from their successes and don't repeat their mistakes. But in the spirit of partnership, this will require a collaborative approach. We've got to harness the energy, the experience, the expertise of all stakeholders in the system, because we can't do this alone. We have to do this collectively. We've talked about patients, and Suhana read our patient statement, the importance of patients and centering this around patients. We've talked about the importance of the jurisdictions, the provinces and territories, clinicians, and the private sector who deliver many of these solutions. We've got to work together to ensure health information can flow seamlessly across all of the touch points of a patient's circle of care, and regardless of distance, time, or location, which is really the true definition of virtual care. And we've got to ensure that we have equitable access to virtual care, including those people in remote and Indigenous communities, as we've talked about. Collectively, I think we can pursue a world where virtual care becomes an integrated part of delivery. And really, we see a world where care is care, whether virtual or in person. But we also see a world where partnerships drive value from virtual care and where Canadians reap the benefits. That was it for me. Suhana, back to you. I think we probably got time for questions, but I'll turn it back to you.
One very quick question, because we do want that participation from our viewers, and that is, our attendees. How can we ensure these recent virtual care wins can be sustained and scaled more broadly? If you could tackle that one very quickly.
Yeah, I think the first thing is to do the analysis and look at the successes and what made them a success. How are we measuring that success? What made them a success? What can we learn from when we do the next project or the next pilot? What can we avoid in terms of some of the things that maybe weren't as good? I think sustainment will also take this collective action. We can't do it alone. The provinces and territories can't do it alone. The federal government can't do it alone. The private sector plays a big role in this because they have to. They are the ones that are delivering the solution. So it's trying to look as a collective at what outcomes are we trying to achieve and how do we best achieve those.
Excellent. Barry, pleasure to hear you speak, and you're obviously passionate about it. I want to thank you for that. Barry Burke, Executive Vice President, Virtual Care Programs, Canada Health Infoway. You be well.
Thank you.
So this leaves us with the end of session number 3. It's been great being with you. If you did miss parts of the presentation or, your colleagues ask about it, the recording for this event will be available next week. So just watch for a wrap-up email. It will come to your inbox. Now, the team at Infoway appreciates your feedback. So let me thump this drum one more time. Please complete the evaluation survey. It's at the right side of the main stage. And that just allows everybody to know what you thought about the session, what you'd like to see more of, less of. It's always great to get. And a big thank you as well to all of the sponsors for their support in making this series available. This could not have been done without your generosity. So here's a quick video on that front. So thank you once again to all of the sponsors, but most importantly, and let me thank our speakers as well. You were great in sharing your ideas, your thoughts, your investigative work on how we can move forward and make this all better and be a part of our own care, if you will. And thank you for joining us as we look forward to the next session. I hope you take the time to join us. The date is set for August 17th. And that program will be shared with you in the wrap-up email. So you'll know what the theme is going to be for August 17th, exactly, what we'll try to make fit into some of the survey feedback that comes in as well. So I'm Suhana Marchand. You've been very patient with me. I want to thank you for your time, and you have a great rest of the day. And more importantly, stay well.